I'm the CEO of United Way of Northern New Jersey and the president of United for Alice. We are unique in the United Way system. There's no other United Way like us because we actually operate very similar to my colleagues at United Way of Polk County. We operate programs and services across 5 counties in North Jersey. We serve over 10,000 families. We focus on childcare, financial stability, supporting Alice in the workplace, and then we have a new initiative really focused on Alice in crisis, not just disasters and pandemics and floods and all of those things, but recognizing that Alice families are truly in crisis every day. So we operate those programs. We have a staff of about 42 folks that work across our region. The United for Alice is part of our organization. Our teams are fully integrated. So that is unique because we also operate this national movement in partnership with United Way, just like here. Back in 2007, how we got started was really looking at what was happening in our counties. We have two of the wealthiest counties in the United States in New Jersey, Somerset and Morris counties. High corporate presence, tons of business units, J&J, Merck, Exxon, big names, lot of resources, very high income, but we were seeing tremendous demand for services and support. Seniors spending more than half their income on housing, childcare being the #1 cost item for a family, tons and tons of issues. But yet, when we looked at all the community data, in particular the federal poverty level and other publicly available sources of data, it wasn't really telling the true story for those counties. So we were fortunate to have a woman named Dr. Stephanie Hoops, who some of you may be familiar with, on our board at the time. She was a public affairs, political science professor, an economist at Rutgers. And she said, let me look into this. And so literally from a very much conversation, grassroots kind of effort, assembling other researchers and experts in that economic stability space, we built the ALICE methodology, took all the publicly available sources of data, and really were able to provide something that's the alternative to the federal poverty level and that provides a more accurate measure of what it takes to live and work in a modern economy. So that's kind of how it all started and has literally grown, as you can see, to 35 states across the country. I've shared this with the team at Polk County and some of your volunteers and board members last night. Florida was there from day one. You guys were there from day one. You've been with us. You've been leading, been doing work, actioning the data, figuring out how to engage partners, really, really living the ALICE movement. And so many of the best practices that we see across the country started here in Florida. So you really, really need to feel very good and very strong about what you're doing to support ALICE families. But for those of you who may not know the term ALICE, well, actually, let me do a quick, how many folks have heard the term ALICE? So almost everybody. So ALICE stands for Asset Limited Income Constrained Employed. We have data for over the 3,000 plus counties in the country where we look at what it takes to live and work in a modern economy. We match local wage with local costs of living, and we create something called the ALICE Survival Budget. And that anyone that earns, any households that earn below that number, which I'm going to talk about in a few minutes, is considered to either be ALICE. And then when you combine that with the families that are considered to be in poverty, according to the federal poverty level, and I would assume every hand will go up when I ask about folks knowing the federal poverty level. Okay, so when you combine those two numbers, that gives you the percentage of households that we call ALICE or in poverty or folks that are struggling. So that's really the core of the data. We have a research advisory council that every year reviews our methodology. We have over 300 members, economists and all kinds of PhDs and academicians and experts that really study all the different aspects of a family's budget. I'm going to go through some of the data today. At the end, we'll talk about different resources on our website, different tools, different analytics that really bring the data to life. Kind of in the middle of my talk, we're going to do a little activity, a simulation. Fingers crossed, Tara, we've tested it, so it should work. That'll invite you to take out your phones and scan a code and enter in a number, and you'll go through some questions with me. But please feel free, pause, ask questions. You know, we can take them as they come. I want you guys to get as much out of this as you're looking for today. Let me see here. All right, so I kind of went through this slide already, but one thing to talk about here is when we think about who Alice is, right? We know that I often think about, you know, when you start your day, right? You literally leave your house in the morning. How many Alice workers do you interact with, right? Whether you stop for coffee, you know, grab gas, whether you drop your child off at childcare, you stop in to visit your senior or an elder person that you're checking in on at assisted living. You know, before you get to noon, you've probably interacted with 4 or 5 Alice workers already. Alice workers are essential workers that we really shined a light on during the pandemic. Our home health aides, our baristas, our retail workers, our hospitality workers, a lot of the folks in our economy that the jobs will not be subsumed by AI. You know, we need people in these jobs, and yet we often don't really understand the struggle that these workers are going through week after week. I think when we understand who Alice is and we see Alice for the first time, you really can't stop seeing Alice. I know that's how I feel everywhere I go. Every time I sit down and I order, you know, a coffee, or I sit and have dinner, or whatever it is, it's the first thing that comes to my mind is, you know, who is this person that's helping me in this situation, and are they able to take care of their bills and take care of their family? I don't know if other folks have had that experience. All right, so let's talk a little bit about the data. I gave you a little bit of a primer, but essentially this is looking at, and I know this is not great. It's never good when we put these up on the slide. So my apologies, and we'll make sure we get the deck out to folks. But all of this is available on our website, unitedforalice.org. But essentially what you can see here, the column on the left shows the budget for a family of 4, and with an infant and a preschooler in Florida. And you'll see that the budget increased from $66,324 in 2021 to $81,120 in 2022. The gray column all the way to the right is the federal poverty level. So you see the big disconnect of what we're talking about here. And these numbers are very modest. If any of folks have spent some time digging into the Alice data, the numbers that we're estimating in the survival budget, they're not big numbers. They're very, very, very modest numbers. And so we know that it does show a big contrast, but we know those 2 numbers I mentioned, and now sitting in 2022 at around 81,000, we know that that's just the bare minimum, really, for Florida. Looking at Polk County, we see that you have 15% of households that are in poverty. So that's benchmark against that 29,000 for a family of 4. But then when we look at the Alice survival budget, we see an additional 33% are Alice. So it's 48% of households in this county are either Alice or in poverty. Does that number resonate with folks? So let's talk about your trend line, right? So from 2010 to 2022, it's pretty clear, right? The number of Alice households in Polk County has been steadily growing. We see this across the country. This is not unusual, so I don't want to be, this is the part of the remarks where I feel very much like the Debbie Downer. But I promise you, we're going to end on a high note. But when you look at the trend line, you see the number of households increasing. And talking to folks yesterday, I really understand the tremendous influx of families and children and just population growth for your area. So that's already accounted for in the data. You're still seeing a tremendous increase in the percentage of households. And then drilling down on some of the specific census tracts, when we were going through the deck with Rod in preparation, right away you said these absolutely make sense. So if you call out frost-proof, you're seeing 60% are below Alice, Lake Wales 54%, Winter Haven 52%. And this is why I think the data is so important, because without having the ability to be very granular and get down to the census tract or the Puma tract or whatever way you want to slice and dice it that we have available on our website, it really masks what's going on. Even though 48% is very high for the county, when you look at these numbers of 60, 57, 52%, it really then helps you figure out where Alice lives and where those families are that are struggling, and helps you then figure out how you can support them and where the gaps are and what strategies can be lifted up in order to specifically target these families. Any surprises here?
Yeah.
A little bit? Yeah. So then, of course, when we drill down and we look at different nuances and demographics within households, we do see disproportionate impact and higher numbers of Alice and families in poverty among Black and Hispanic households, under 25, and then above 65. And in fact, we're about to release our update in May, and so you'll have new data in just a couple of months. The number one demographic that's increasing for Alice is people 65 and above, right? And I would imagine, that's a huge indicator or a huge issue here in Florida. And then obviously single parents. So just some specifics, 61% of Alice households in Polk County are Black, 52% are Hispanic, and 43% are white. And then when we take into account, looking at kind of the most common jobs in Florida, and you look at the salary and the number of employees that have those jobs, these are the 20 most common jobs in Florida, and then these are the top 8 that fall below the Alice threshold. And if you look at who these people are, as we talked about, just a few minutes ago, these are all folks we need in our community, in our economy, in order for each of us to get through our day. Any surprises here? The nurses always surprises me. Okay. And then obviously we want to talk a little bit about SNAP. I would imagine this group is very, very acquainted with SNAP and how everything works and the gaps. SNAP is actually typically the only form of publicly available assistance that an Alice family may receive. Not always, depends obviously on income. But we know this is where we see the big difference. We know that in Legislative District 18, which we pulled as an example for Polk County, because of course the districts don't align with county data, so it's a representative sample. We know that you've got 50% of households in District 18 are either Alice or poverty. Yet when we look at the SNAP data for District 18, only 15% of those households are receiving SNAP. So for folks like us, right, that's a huge opportunity for us to get to those families and help those families get enrolled and determine eligibility. I think this is Scott Franklin's district. I don't know, is he might be here? Okay, all right. Okay, any questions or thoughts or anything to share at this point before we go into the simulation? Okay, so we're gonna spend a few minutes kind of going through what it might feel like to be living in an Alice household and kind of experiencing some of the challenges and economic situations that an Alice household may go through on a given month. Again, when we talk about Alice, we talk about asset limited, income constrained, employed. For the purposes of this exercise, today the family that you're going to be in is a two-income household with 2 children. One person is an elementary school social worker, the other is a home health aide, and you have 2 children. One is in daycare and one is in public preschool. Together, you earn $78,580 annually, which comes to $6,548 a month. This family will spend, on average, per month, $5,124 to cover housing, childcare, transportation, healthcare, technology, and taxes. So that leaves $1,425 to cover the remaining monthly expenses and anything else that comes up. So let's see how that money gets spent over the course of a month. Okay, it's the first week of the month, and there's a choice to make. Unfortunately, your infant was sick, and your child care center will not let them return tomorrow without a 24-hour waiting period with the fever. How many of you have experienced that with children? How many of you have dosed your kids up with Tylenol and sent them anyway? Okay. All right. That's not in the script. But you need to hire a babysitter to stay home. That'll cost you about $100 for the day. Or you stay home and you'll lose $125 since your hourly wage job has no time off. What are you going to do? So you can enter your response on your phone. And vote now. Would you pay the babysitter $100 or take the day off and lose $125? Wow. We're All right, while we're tallying up these votes and getting the final number, let's talk about other expenses. You go grocery shopping, which costs you about $250, and then your eldest child comes home from school and tells you about an upcoming class trip that they need $20 for. So these 2 expenses leave you with $1,155 when you take out the money for either the babysitter or staying home. Oh, here, or $125 for the lost wages. So we're down to about $1,030 for the rest of the month. Okay, here, let's go back and see what you guys voted. Okay, so this is fascinating. You're literally split right down the middle. I think that demonstrates what a true dilemma this is for a family, right? And I'm sure many of you went back and forth, like you couldn't really decide. Okay, so let's go to week 2, another round of impossible choices. So it's week 2, and your toddler is turning 4. They're currently in love with panda bears. You want to invite a few friends over, keep the cost to a minimum with a homemade panda cake, some chips and games, and a little goodie bag. But you're also due for a refill on prescription medication for yourself, an expense that you pay out of pocket. So the party will cost $50 for 5 friends, while your medication is $100. You can't do both. Either you throw your little one the party they're so excited about, or you go without your medication for now, which could impact your health later. Or you pay for the refill, and risk disappointing your toddler. Can you give me your vote on this one? This is really hard. I mean, I love pandas. So while you're considering this, you also have to go back to the grocery store for week 2. You spend a little bit more money at that grocery store that week. You spent $2.75 because you had to buy laundry detergent and shampoo, which we know. I don't understand why they cost so much, but they do. So your weekly grocery bill is $2.75. And then you have an unexpected expense when your colleague at work asks you to chip in $15 to support a meal train for a coworker who's recovering from a very serious illness. So that means you spent $290. And when you subtract either the $50 for the panda party or the $100 for the medication, you're down to about $650, $700 for the month of what you have left for another 2 weeks. All right. Okay, so here we were much less divided. You all are about the meds. Okay. Okay, so yeah, just a rundown of what was spent. So we're back down to about $650, $700 for the rest of the month. 2 weeks to go. All right, here we go. Now we're into week 3 of the Alice family's budget. And your partners decided to enroll in an education program that will improve their chances for a promotion. Good news is the job will cover the tuition, but you need to buy the book for the course, which costs about $120. Also, winter has hit your area very hard this year, and your landlord keeps putting off repairing the heating system in your apartment. So you're thinking you might want to buy some space heaters, which would cost about $150. What do you choose? Heat or the textbook? I was telling the team last night, I could tell you what my mother would have done, 100%, because she did it. She put us to sleep when there was no heat. She put us to sleep in those, pajamas with the feet that were very popular. But she would zip us up the back because I guess my brother used to take it off. I don't know. She would zip us off the back. Somehow she cut the feet. I don't know what she did. And then she would put our winter coats on over top. And that's how she put us to bed for a very long time, a couple of years like that. So I think that my mom would have continued that and not done the heat. Okay, so we've got 57% for the textbook, 13% for the heat. Okay. So then you're also back at the grocery store for another $250. All of a sudden the bank comes through with a $35 overdraft fee. That was a mistake. But again, how many of us have made that mistake? I mean, many of us. $35 is a lot of money when you're living on those tight margins. All right, so then we go to week 4. Oh, excuse me, 1 second. Sorry, I got my slides mixed up. Here we go. So we've got to spend another $250 in groceries, leaving you with $50 or less for expenses for the rest of the week. And here we go. This is where the last week of the month, all hell breaks loose, right? $300 to replace your broken car windshield from a storm that just hit your area. That literally happened to me 2 days ago. I left my house for this trip with my windshield cracked. $250 for a cracked tooth that's not covered by your dental plan. $150 for a flat tire that you received coming home from work. So let's say we go with the flat tire, because that's the one that's most urgent, and you only have $50 left. How would you cover the gap? What would you do? This is a raise your hand, so we'll give the Mentimeter a break. Would you dip into your savings to cover that other $100? Would you put the $100 on a credit card and figure it out later? Or would you ask a family member or close friend for some help? So let's go through it again. How many would go into savings? What about the credit card? Who would do the credit card? I would probably do the credit card. Right. And then what about asking a family member or a friend? Yeah, so that's always an interesting one because Most of our family and friends are also struggling in most cases and don't really have the flexibility. We also know that most Alice households don't really have savings to be able to draw down $100 and then try to replenish it. And a lot of us have credit cards that are maxed out. I mean, we know the national credit card data, right? The average family has about 30,000, right? So as you were going through this activity, how did it feel? Please feel free to raise your hands. Feel free to raise your hand, and I think on the Mentimeter you can type in words to describe how you're feeling. Please.
Hopeless.
Hopeless. Please, just call it out. Other words. Stress. Conflicted. Exhausted. Frustrated, right? Many of you work in the nonprofit public sector, so another piece of data that's not in the slides, but to share, and I shared this with the team, is we did a special report on the nonprofit workforce. There's 13 million nonprofit workers in the United States. It's the third largest private workforce in the country. So we're a big deal, right? Our sector's a big deal. I've been in this sector for 33 years. Like, this is we do tremendous work, and our communities need us, all of those things. But when we look at Alice in the nonprofit workforce, 33% of that 13 million nationally are either Alice or in poverty. And so when we think about the folks that are taking care of our most vulnerable, children, seniors, everything in between, we know that we have a workforce that's struggling as well. So there's all different sides to this, and I appreciate you calling out the workforce piece. Thank you for that. All right, well, thank you. Thank you for going through that exercise. And so we're just going to spend a few minutes talking about some of the tools, some of the resources. How do we bring the data to life? How do we action the data? And the first thing I want to draw your attention to, and this group is such a perfect group to help with this, is we are collecting the voices of Alice, Alice stories, Alice narratives. And this is a section of our website called Alice Voices, where folks can literally do a voice memo recording and then just upload it onto the website. And I will tell you, we get a lot of calls nationally from different press and foundations and government leaders they want to hear directly from Alice. And so there's opportunities there to really share and shed a light on specific families, specific households. So please, I really encourage you and I ask you to help us kind of collect those specific stories. If you're not sure, if you think you may know someone, you're not sure, please just reach out to me. We'll help make the connection, but I encourage you to check it out. And then we talk about, again, going back and harnessing the data. We've got the Alice data available from the very top nationally down to the state, obviously here in Florida, the county subdivision, zip code, legislative district. We've got it available all different ways, and it's very user-friendly. It's literally drop-down menus, and you can slice and dice very much in real time. So I encourage you to spend some time on the website. That legislative district tool, and I gave you a little bit of a glimmer when we talked about District 18 and the SNAP situation there, but that legislative district tool, as you kind of spend time and you're meeting with legislators and talking about the needs in your community, it's very powerful. It's a visual demonstration, kind of a GIS map, where you literally can show the legislator, and I've done it many times, their district, and highlighted in dark blue is where you see high percentage of Alice and poverty. And them or their staff, their eyes like blow up, because either they didn't realize it, or they say, oh, that's why we have so many constituent calls coming in from that part of my district. So it's really powerful. And then that leads to conversations around funding and support and partnerships. So I definitely draw your attention to that. Another tool we have is the Alice Status Income tool, where you can look again at wage, occupation, and then where Alice lives in a particular county. And this is also something we get a lot of good feedback on as you're thinking about kind of job growth, workforce issues, what wages should be in order to not be Alice. It's a really helpful analytic. Another piece of the website is we've collected. I mentioned that so many best practices come from Florida. And this is where they are on our website. It's called the Alice in Action. So it's a searchable database where you can enter in a keyword, and all solutions and programs and best practices from all over the country come up as resources. So I encourage you to definitely spend some time there and upload. Definitely send us ideas and things that you're doing in order to help Alice families here in Polk County. The last thing I want to do is, well, maybe not the last, I'm not quite sure, but anyway. The one thing I want to call your attention to is a new tool that we actually launched last year at the summit. It's the Economic Viability Dashboard, and I think we're going to show a little video. So yeah, I wanted to share that video because it gives just such a brilliant summary of what we call the EVD, the Economic Viability Dashboard. And it's a great way to engage stakeholders from all different perspectives, all different parts of the community to really focus. And then it connects you to that action planner. So it really is something we're really proud of, and I'd love to get some feedback from folks as you get the chance to dig into it. And that is our website. We've mentioned it a bunch of times, and I think, well, I know I'm over time. I'll be here for a while, so feel free to grab me at the break. Again, I just want to say thank you so very much for inviting me to spend some time with you this morning. You know, you're doing the work. You are out there, you're serving communities, you're taking care of families, and just know that everything you do here on the ground is very much appreciated, not only by us in New Jersey, but the entire United Way network. So thank you, and I look forward to getting to know each of you a little bit more today. Thank you.